This is Dr. Teresa Soto. I work at the Fairfax and Fredericksburg offices at Center for Vein Restoration. And what I'm talking about today is what is compression strength? What does that mean in a compression stocking? And how do you choose the right compression stocking for you? Compression stockings come in kind of a mild, moderate, and higher compression strength, depending on what you've got going on in your legs. An 8 to 15 millimeter compression stocking, it talks about millimeter of mercury and how much pressure it applies to your leg, with more compression pressure in your foot and ankle, lessening as you go up your calf and thigh, so that you have blood and fluid return assisted by the compression stocking. 8 to 15 is kind of a mild, everyday, no real major medical problems with your leg, something you wear when you travel just to prevent a little bit of swelling. Our 10 to 15s are for somebody who's having a little bit more swelling on a daily basis. 20 to 30 millimeters of mercury is typically what we use for folks who are having swelling from venous insufficiency. Knee high versus thigh high depends on whereabouts your swelling is a problem. So if you are having swelling mainly below the knee, a knee-high compression stocking is the way to go. Wearing something just to the ankle if you have swelling in your lower leg typically results in like a mushroom top over the top of that compression, so at least a knee-high is recommended. If you have swelling or ache all the way up into the thigh, then a thigh-high compression stocking is recommended, again at 20, 30 millimeters of mercury. 30 to 40 is really reserved for somebody who's had chronic, long-standing venous hypertension, ulceration, previous blood clot. They're more difficult to get on, and they are something that we really reserve for somebody who needs to have that much compression strength. So on average, if you're having generalized, just aching, cramping, kind of a low-grade swelling in the ankles or at the front of the shin, something in the 10 to 15, 10 to 20, or 20 to 30 range is where you're looking. If you're having more significant swelling and aching, then 20 to 30 is definitely where you should be looking. And again, knee high versus thigh high or versus pantyhose. Pantyhose are kind of tough to get on, would be related to where your swelling seems to be coming from, thigh level versus the calf level and down. Or if you're having aching up in your thighs, you should definitely be having something that will give you some compression and support up in your thigh. So that's the basics on it. Thank you for listening.